lateral surface of the thoracic limb. So here we have our cephalic vein, right? And on each side of that, we have the superficial branches of the radial nerve. Our cephalic vein continues to the external jugular vein here. So that's where it's continuing. And then we'll go through ulmobrachial and axiobrachial on the other dog. So here's our external jugular vein. If you continue that cranially, external jugular vein, we have maxillary, and then lingual facial. And we have our mandibular lymph nodes and mandibular salivary glands here, and here are the lymph nodes. Okay. So then we go into the axilla. The best way to identify these are to see where the vessels are going, and that's how you're going to identify them. So we'll start with the nerves. So this nerve here is going into our biceps brachii. So that's going to be musculocutaneous here. This nerve here, I see it's running on the medial surface and then going to the ulna. So this is the median ulna common trunk. And it branches off to median nerve and ulnar nerve here, going to the ulna. You can always pull on nerves too. That should help you identify them. The nerve cranial to the scapula, going to muscles like supraspinatus. So that is going to be our suprascapular nerve. Let me see if I can find it. That should be this nerve here. So cranial to the scapula. And then the nerves going into subscapularis is our subscapular nerves, and that should be this nerve.
Sorry.
Then I grab this nerve here, and I see that's running through the triceps, so that's going to be our radial nerve, okay? Radial goes through the triceps, and then comes out on the lateral side of the front limb. Then the last nerve that goes through teres major and the scapula is going to be our axillary nerve. It should be this nerve in here. So just remember that goes through teres major and the scapula, okay? Should be that nerve there. So then if we follow the radial nerve here, we'll see it goes through the triceps. And I think it's been cut, but comes through the triceps, so we have our radial nerve here. And then it's gonna have a deep branch going into the extensors, and then a superficial branch that courses along cephalic vein, okay? We had our external jugular vein, and then now we have the axillary vein here, and the brachial vein here, now that we're in the brachial. Brachial vein, axillary vein. So then now this is our axillary artery. And if we follow it, we have the subscapular artery here. This is still axillary. This branch here is cranial, circumflex humeral, and at this branch here, axillary turns into brachial. And if you continue brachial, now that we're in the antebrachium, still brachial, distal to the elbow joint. We have our common interosseous branch off of brachial here. Then at that branch, brachial turns into medial. This is medial here, and then median. Sorry, excuse me. And then we have the median artery, and this branch here, small little branch that branches craniodorsal, is our radial artery, and then median artery. Okay? It should be every